The Ebola crisis in West Africa, which is threatening to spread to other parts of the world. We discuss the epidemic and what the future holds. Plus, what can birds tell us about our climate? That's coming up later on the show. From Melbourne, you're watching The World from Below. I'm Lizzie O'Shea. Tonight we are joined by Nobel Prize-winning scientist Professor Peter Doherty. Professor Doherty is a veterinary surgeon and medical researcher by training. In 1996, he was the joint winner of the Nobel Prize in Physiology or Medicine. He was also named Australian of the Year in 1997 and is a National Trust Australian Living Treasure. Professor Doherty's research focuses on the immune system, and his Nobel work described how the body's immune cells protect against viruses. He is also the author of several books, including Pandemics: What Everyone Needs to Know. Let's begin by looking at the crisis of Ebola in West Africa that has killed nearly 5,000 people. The World Health Organization estimates that within 2 months there could be as many as 10,000 new cases of Ebola each week. Professor Doherty, as an immunologist, you know a lot about viruses and how they spread. Are you surprised by what's happened with the outbreak of Ebola?
Sure, it did surprise me, and I got it quite wrong when I wrote my book on pandemics, because we'd had the experience. Ebola has been around since 1976. And over those years, I think a couple of thousand people have been infected that we've known about. And it's been handled quite well. There have been succeeding outbreaks, particularly in the Congo. And Western doctors and the local doctors have all got together and they've contained it very well, used barrier nursing, and really brought it under control. And this time, though, it got away. The response wasn't quick enough. It was left to missionary doctors and to Doctors Without Borders, who are overstretched anyway, and there wasn't that additional help that came in quickly, and the population in the countries where it emerged wasn't accustomed to it, so they really didn't know what to do and were confused and frightened.
The Abbott government has been criticised for not doing enough in respect of Ebola, and Tony Abbott himself obviously rejects that. Do you think we are doing enough, and what more could we be doing?
I'm sure we'll be asked to do more. The Abbott government has been concerned about sending in medical professionals. One advantage of actually sending in, say, some of their military doctors would be that they get the experience of working with an outbreak like this, because it's kind of unusual to have to confront something like this. But there are other ways of helping as well, and I think Australia will be called on to do more, whether it's financially or in some other way.
It does seem like we've got a window of opportunity to try and stop the spread of the pandemic exponentially. Is that right? Is this a period of time?
Yes, a lot more resources are going in now, a lot of American resources, more from Europe. And the calculation is basically, if 70% of the cases can be identified, quarantined, separated, then the whole epidemic will burn out. And that's the mathematical modelling. And it will burn out, and I think it will be done.
Okay, so you've written how the crisis in respect of Ebola has been exacerbated by poverty and so the social disruption that goes with poverty.
Yes.
We've also seen failures in how the United States has handled the infections they've seen of Ebola. To what extent do you think public health infrastructure is critical to managing a risk like this?
It's absolutely critical, and it's critical that we keep up our spending on public health. And I think also we should learn a big lesson from this, and that is a lesson we need to be much more prepared. With Ebola, we could have had anti-Ebola drugs. There are anti-Ebola vaccines that are pretty much ready to go. In fact, I've just been catching up on reading my older copies of some of the journals. Back to September, SmithKline was offering World Health Organization a vaccine. It would have had to ramp up production to make any sense of it, but that could have been done, and it wasn't. I mean, the World Health Organization really dropped the ball on this one. And that's part of the problem.
I mean, I know industry says that the burden shouldn't entirely fall to them as well, that it has to be taken up by international institutions as well as governments.
No, we can't expect industry to carry all the burden of this. What happens with many of these situations is that good drugs, vaccines and so forth are developed in what we think of as essentially academic institutions. The Vaccine Research Center at the US National Institutes of Health, for instance, was publishing on what looked to be a pretty good vaccine as far back as 2010. But But a lot of the big costs aren't in the research, they're in carrying it forward to do the safety testing and to do the efficacy testing. And that's where you're getting into hundreds of millions of dollars. Now, we're short-circuiting some of that, actually. But we should have that all ready to go for dangerous pathogens that are out there in the environment and be much better prepared. There are two reasons for that, I think. One is the infections emerging from nature. Also, when something like this happens, it's kind of a signal to bioterrorists that you can create great fear by threatening with these types of bugs.
Absolutely. I mean, what also shocked me about the response in the United States is that the presentations to hospital were missed for the index patient, and also that then the Centre for Disease Control seemed to be caught on the back foot. And I understand that that kind of infrastructure needs to be ready in rare situations and then swing fully into action, but it does still suggest to me that we could be better prepared.
Yes, of course. We should have been much better prepared. I think the Australian medical community is pretty well prepared. I know that the Chief Medical Officer said we haven't handled something like this, and that's true. But certainly talking to my colleagues at the University of Melbourne, they're extremely well prepared. Everything is well set up. And I think that's probably generally true. We have a high level of professionalism in our infectious disease community in Australia. And so I think if we do get any cases here, and it's by no means certain we will, then I think that will be handled quickly, and that I'd be very surprised if there are secondary infections. The initial case in Dallas was handled badly by the hospital. They didn't have proper protocols in place. They hadn't thought it through. History was taken by a nurse and wasn't handed up to the doctors, or they didn't get the message. And then they didn't know how to really deal with it. And now it's quite different. As soon as there's any report of a case or suspicion of a case, we'll have CDC professionals in the hospitals overlooking it. And it's very likely, I think, that cases will be taken out and taken up to, say, the Navy Hospital in Bethesda or somewhere like that.
It's interesting reading some of the reports about West Africans who weren't presenting to hospital when they suspected they might be infected for fear of what might happen. And yet we've also seen in the places like the United States a lot of fear amongst the general population about the potential consequences of an Ebola outbreak there. I mean, you're someone who knows a lot about pandemics and how they spread. What role does the media have in dealing with these kinds of issues?
I think if the media is responsible and puts out good information, which usually in a sort of crisis situation, of course, they're going to do, then I don't think people need to be terrified in the United States or in Australia, because I think it will be handled quite well. I'd be for instance, one of the nurses who got contact infection from that index patient in Dallas travelled on a plane, and that plane was in use for a considerable time. I'd be extremely surprised if there were any cases that came from contact on that plane, either with the nurse, or because she was quite early in the infection, or with the actual plane itself. This is not a virus that survives well on surfaces. The SARS virus actually survived well on something like a table or a door handle. This one doesn't. It's a very sensitive virus. So personally, I think that the chance of any substantial epidemic or outbreak in a country like Australia or the United States is quite minimal. Where we'd worry, though, I think in our part of the world, is if the virus got into somewhere like Papua New Guinea, which doesn't have the resources that we have. But again, I think we'd be there to help very, very quickly.
I certainly hope so.
Yes.
Okay, we're going to take a short break and we'll be back to talk further with Professor Peter Doherty. Stay with us.